I'm John Burns, President and CEO. John, John, Burns, Burns, President and CEO of Westminster Canterbury. It's with a heavy heart that I stand with here today to share with you that the Virginia Department of Health and Westminster Canterbury Richmond have been engaged since last night because it was determined that a resident of ours who is hospitalized at VCU Medical Center has tested positive for COVID-19. The resident has recently traveled to Virginia from Florida. Virginia Department of Health is partnering with us on our campus to trace all staff and residents who've come in contact with the resident prior to the hospitalization. All potentially affected staff are at home and in quarantine. Westminster Canterbury Richmond set up a coronavirus task force at the beginning of March, with our first task force requiring action was to require all travel information be gathered by relative to both staff and residents. On staff, we have an infection control preventionist who is an RN full-time, and she was our incident commander for this event. Westminster Canterbury Richmond began screening, asking the questions relative to symptoms, travel, international travel, and exposure, and temperature checking all staff who entered the campus starting last Wednesday, well ahead of any recommendation from any of the government agencies. At this time, all residents are staying in their apartments, and we'll be supplying them with meals and whatever else they need throughout the day. We're doing our best to keep our residents well informed. We have an in-house television channel, and we did a communication with them this morning at 9 a.m. to share basically the same information. We greatly appreciate our partnership with the Virginia Department of Health. They've been incredibly helpful today as we work through this process, communicate, and plan for the next phase of this experience. Right now, I want to turn it over to Dr. Danny Avila, who is with the Virginia Department of Health. Doctor.
Thank you all. Good afternoon. Danny Avila, Public Health Director for Richmond and Henrico. We were notified last night of a positive case and immediately engaged with the infection preventionist here. There's been work throughout the night to try to assess the degree of risk to other residents here at the facility, and you know, we've been talking for some time about vulnerable populations and knowing that our elderly residents and residents with underlying conditions are the ones who are going to be most at risk. And it was just a matter of time before we saw this in one of our retirement homes, long-term care facilities. And I'll say there's in some ways, a sigh of relief that it's at this one, because as we've engaged starting last night with this team, the professionalism, the planning that has gone into place has been unparalleled. You know, as a facility, having a single point of entry, having screenings set up for every staff member and every resident who's returning from somewhere to be screened for symptoms. Those are the kinds of interventions that are going to really limit the spread of disease in this facility. So, you know, we're currently doing our epidemiologic investigation, really understanding who else might have come into close contact. Thankfully, the initial report looks pretty good that this individual seemed to not have a lot of traffic throughout the facility. At the behest of their children, they were social distancing themselves, which is really good news for everyone here. So there will be certainly some contacts that we will need to quarantine and monitor. The team has already done a great job of identifying staff who may have come into contact with the individual. They have already been kept out of work, and they'll be quarantined and monitored as well. So things will continue to unfold, but the early reports in terms of our history and our investigation look really good. Questions? Yep, he's a gentleman in his 80s, and right now appears to be in stable condition, not in any intensive care, which is also good news for him. And as Mr. Burns said, he'd been traveling out of state, was returning home from an extended time away, and that's when his symptoms developed.
Do we know where in Florida this man came from?
I do not know. Sorry.
What type of testing is taking place to ensure that others don't have it or staff don't have it?
So right now it's all about quarantining and monitoring of symptoms. We are having more test kits come in regularly, and if anyone were to develop symptoms, we would test them immediately. And then there may be, based on exposure, there may be other cause for testing as well. But right now we're quarantining and monitoring for symptoms.
They still have to fit the criteria in terms of fever, cough, things along that line.
Not the specific, like the stringent criteria that the Virginia Department of Health has had to use because we've had limited test capacity. But if they develop any symptoms that might be consistent with COVID-19, we would test them. They're now a part of a cluster investigation.
Do we know if this person lived in Richmond International Airport?
I don't know the answer to that, actually. Sorry.
I do believe so. I can't confirm it, but I believe so.
Dr. Bull, on the NIH website where they track the coronavirus cases, they say that there are 2 in Henrico County, but none in Richmond. This is a facility in Richmond. So what are these?
This is actually Henrico County. Yeah.
I could speak to it. So technically you're right. We're standing in Richmond, but beyond the gates is Henrico. So everything inside the property is generally everything inside the property is in the county of Henrico.
What are the 2 Henrico cases?
The case that we talked about yesterday was a young woman in her 20s who had traveled down to North Carolina, and then this is the second case.
Do you know how many people have been sent home to self-quarantine?
So I don't know the exact number, but I would estimate it to be in the range of 25 staff who've been exposed during the period of which this person was on our campus and there was potential for exposure.
Is the gentleman live alone?
The question,
Does he live alone? Does he live alone?
no, he has a spouse. Other questions?
John, can you talk about the layout of this campus? It said in the release there's 900 residents. So how is there a wing that's under quarantine now, or
So the question is, we have roughly 900, 865 or so residents in a number of different buildings. At this time, all residents are under quarantine in their apartments or in their homes until such time as we're told by the Virginia Department of Health who in their epidemiological trace has been exposed. Once we know who that quarantine group is, we can begin to lift the restrictions on the rest of the property. But we really take our direction from the epidemiologists who tell us, and they're not through that exercise now. We expect, that's in process, but we'll be lifting that hopefully later today or first thing tomorrow. But we'll see.
Mr. Burns, you said that you spoke to your residents at 9 o'clock.
Mhm.
How do you reassure them that it is?
Well, what we shared was the truth. As to the degree we know the facts, we shared the facts, same facts as shared here with you, and that we have had great policies and procedures, very sound process, super skilled staff who've been meeting every single day since last Wednesday to plan, because we had to expect this was going to happen and be prepared for it. That's what our residents have had to know going into this, is that we have the confidence and the competence to handle this situation. And it's as I said, this is a blow to the organization. We have to get through this now and keep everybody else well. But we are a very solid organization who know what we're doing. And we'll talk again with the residents at 3, and we'll talk more about the specifics of meal delivery and dog walking and mail delivery and newspaper delivery, because that's really where the questions are now. They understand the quarantine component. By and large, it's now how do we get back to living here? And we're not there yet, but hopefully later today.
John, we know there are multiple facilities like this one here in the greater Richmond area. Have you talked to any of those other facilities
It's a great question. I'm going to introduce you all to Melissa Andrews. She is the president of Leading Age Virginia, which is our state association for nonprofit senior living organizations, and I serve on the board of Leading Age Virginia. Melissa can speak to that better than I can.
Sure, thanks, John. So we've been in constant communication with our members, not just in this region, but statewide. We have about 140 communities across the Commonwealth that are our members. And everybody's taking the same steps. I will say that Westminster Canterbury Richmond was ahead of the curve. They were the first to really shore up. We know it's not a matter of if, it's a matter of when. So we have been for the better part of at least 2 weeks sharing resources, sharing policies, sharing procedures, best practices, talking about staffing. You know, with schools being closed, staffing is a challenge, right? Because people have their kids at home. So looking at resources, PPE, all of those types of things. But I would say the network is strong, and our support from the state agencies has been incredibly strong for our members as well.
We know the governor is asking folks over the age of 65 to self-quarantine. Do you have any other advice? I mean, obviously this may affect seeing their families and everything like that.
Yeah, so my mother is self-quarantining. I've made perfectly sure that she does that, and I drop off food on her at her apartment door every day that she picks up when we knock. And so I think it goes beyond that. I think we all have a responsibility to stay home if we can. That spread is not just from 65-year-old to 65-year-old, right? It's the rest of us that are also capable of community spread. So absolutely our older adults, especially those with chronic conditions, should stay at home. But we have to remember that those 65 and older, they're not necessarily retired. A lot of them are still working. So they have to abide by whatever is happening within their organizations. But taking the governor's lead from this morning's press conference is, don't get together with people, don't get together and celebrate St. Patrick's Day, even though we want to. Take community mindedness at heart and stay home.
So that this is a facility that's taken every precaution, the earliest to do so since last week, this Tuesday, that we're finding this like the first case basically with the nursing home and facility. Like, what does that tell you? Like, because they were so stringent, they found the case, and it's inevitable that
It's certainly inevitable. I would say that it feels more chance that it happened here than I've talked a lot this week about just the lack of testing we've had available to us here in the state, and that we've really limited testing to people who meet certain criteria. As you heard the governor talk about this morning and out of the White House this weekend, we expect to see a few thousand more tests available to our community this week, and I expect that we will see cases popping up in facilities across the region, and we've already firmly established that there is community spread happening here in the region.
Is the gentleman's spouse?
She is in good health, self-quarantining. Self-quarantining, yes.
Is she remaining in the apartment, or has it been living separately?
Yes, so they live together, and she is self-quarantining in their apartment. And to the comment, the question before, we restricted access to all visitors last Thursday. No non-staff allowed on campus and contractors. And on Thursday morning, we closed our nursing home and our assisted living to all non-clinical staff. So there hasn't really been any opportunity to the degree we can lock things down like that. We took the governor's advice for everyone last Thursday, and we've held fast to it and closed our gates, screened everyone through a common single point access, and asked every single person coming onto campus the questions as recommended by the Centers for Disease Control and Prevention. I think, to your question, is it inevitable? With residents that travel and who are active, just like everyone else, I think all we could do is be prepared, and we were very prepared for this.
John, just to clarify, was this resident exhibiting symptoms, or was it simply a test because he had traveled to Florida?
to let Dr. Avula
Yeah.
comment to that.
He was exhibiting symptoms, although not, not the traditional symptoms that you would expect with this. And so, because of some of the symptoms he was having, not cough and fever and congestion, he was taken to the hospital and tested at the hospital. And it brings up an interesting conundrum from a disease transmission standpoint, because especially in an elderly population that has often a suppressed immune response, we may not always see the high fevers or the cough and congestion that we've come to expect as we've been monitoring this disease over the last few months.
I believe it was early last week. I don't know the exact date. Yeah, thank you all very much.